Welcome to the Global Missions Podcast, a show for Christ followers who want to participate more effectively in God's work, both at home and to the ends of the earth. Visit us at globalmissionspodcast.com to find show notes, resources, and previous episodes. You can also follow us on Facebook, Instagram, and Twitter. This podcast is brought to you by the Global Missions Toolbox, a new online collection of practical, trusted resources made for those who support global missions from home. Visit us online at globalmissionstoolbox.com to register for access to this growing collection of tools for senders. And now, here's your host, Rob Magwood, better known to many friends as Mags.
Hi, everyone, and welcome to this episode of the Global Missions Podcast. My name is Mags, and I'm here with Maddie, our co-host. Hi, Maddie.
Hi, Megs, and hi, everyone. Thanks for listening into this conversation.
We are very pleased to be welcoming back to the podcast a friend of ours who has done 3 previous episodes, Pastor Doug Christgau. Those episodes would have been before your time, Maddie, before you joined our team, right?
They were, yes. But I do have a list of the past episodes we've recorded with Pastor Doug, and I'd like to share those with our audience now just briefly. They'll be linked in the show notes as well, but lots of great content to come back to today.
Super. Go for it.
Way back at the beginning of this show in episode 21, we talked with Doug about how to build a missions committee. And then episode 91, we discussed balancing local and global mission priorities. And then most recently, in episode 131, we talked with Doug about creative missions events to mobilize your church. So this is a familiar guest for our podcast. Mags, would you just briefly introduce us to the topic we'll be covering today?
Yes, Pastor Doug has migrated into an organization that he's known and supported for a long time, focused on the dimension of medical missions. So today we're going to talk about some of the opportunities, some of the obstacles, and some of the first steps that people interested in medical missions might take. Here's our conversation with Pastor Doug Christgau. Our guest today is Doug Christgau, who, together with his wife, Christine, has served as an outreach pastor in 3 different churches. And in fact, Doug, I still call you Pastor Doug. I know you're not in that role anymore, but if it's okay, I'm going to call you Pastor Doug.
That's fine.
Most recently, Doug and Christine served at Valley Community Baptist Church in Avon, Connecticut. And he really has been used by God to help these congregations send out long-term missionary workers. Over 40 long-term workers were sent out from those churches during his time of service. And many, many people, 2,000 people perhaps, made commitments as missionary prayer partners. Doug has also been really involved personally in short-term trips, and he's personally led teams to 45 different countries. Doug, we want to say welcome back to the Global Missions Podcast.
Thank you, Mags. It's a pleasure to be here, and I'm especially excited to be able to talk about this new aspect of my ministry, which relates to healthcare missions.
Yeah. Well, the last time we visited with Pastor Doug, he was just approaching a transition zone. So that's where we'll start, Doug, today. You have migrated from serving full-time as a pastor of missions into an organization called MedSend. So would you just begin, tell us a little bit about the organization and your familiarity with MedSend and your migration?
Sure. So I was a missions pastor at another church in Connecticut, actually, called Black Rock Church in the 90s. And this was a strong missions church. I was their first missions pastor, but they already had a strong interest in missions when I joined the staff. And there was a oral surgeon in the congregation who had a passion for missions, went on a lot of mission trips using his medical skills. And he discovered that many would-be medical missionaries, people perhaps who went on these short-term missions with him, many of those aspired to be long-term missionaries, career missionaries, so to speak, and they did not actually fulfill that dream and that vision because they had such large debts from their education. So typically by the time that they got done paying off the debt, take 10, 12 years, their passion for long-term missions had subsided and there were no longer prospects for going in the field. So Dave Topazian, who is the founder this oral surgeon. He decided that he would try to put together an organization specifically for the purpose of paying off the educational debt of doctors and nurses who wanted to go into missions. So that was literally 30 years ago, 1992. And I was the missions pastor at that time and sort of was a cheerleader, somewhat of an advisor, and had to put together a mission agency that we were both really just doing it for the first time. But it did become a viable organization. And now 30 years later, we're at a fairly substantial size, and we've developed several other programs. But MedSend plays a key role in advancing medical missions around the world.
Well, I hope that for our audience, those of you who may be involved in the medical community in some way, your ears perk up a little at this episode. Perhaps you know someone as well who already serves in the medical field, and you can share some of this with them. Just to observe, you've sought initially to address one of the key barriers we hear about in missions, Doug, and that's debt that comes from education. So this well-intentioned initiative of being educated and being prepared to serve just creates a secondary burden, if you will, or a barrier. And like you said, that's especially for our medical professionals, that can be considerable. I just appreciate the creativity and the intentionality that went toward trying to remove one of those barriers. Is that still a major focus of MedSend?
Yes, it is a major part. We still give grants that pay off the loans of medical missionaries going into long-term missions, but we've developed two other ministries. One is called the Longevity Program. We have discovered that many physicians especially encounter unique stressors on the field, and often they are returning home prematurely, way before they expected to, for a variety of reasons, but mainly just because it's a really hard assignment to be a physician overseas. So we've developed what's called the Longevity Program, which provides retreats and restoration experiences for physicians before they go on the field and while they're on the field. And then we also have a mentoring program. And this was set up by a uniquely qualified physician who had not only been a missionary physician, he had also been a military physician and had served in combat zones, so knew a great deal about the stresses of trying to do good medical work in adverse environments. So the Longevity Program is our second phase. And then thirdly, about 6 years ago, we began what's called International Scholars. These are not grants for paying off debt, but rather we are giving scholarships for residencies for folks in Africa and Asia who are doing all their training in their home continent. These are not folks who go to the United States for training, but they stay in their home countries. And we have partnerships with several residencies so that their last 4 years of medical training is done in an environment that is guided by U.S. physicians, but these are all nationals. We have about 60 nationals that we have paid residencies for.
Wonderful. Wow. Well, usually it's later toward the end that I ask about websites and things like that. But here, I just want to mention the MedSend website for those of you that may be interested. MEDSend, medsend.org is the website. And there's a lot of information there. We'll hear more about it throughout this interview here. And all of these websites and any references will be captured in the show notes that you can find on our website. Doug, let's go back just a little bit to the very beginning. Let me ask this. Why is medical missions a strategic part of the Great Commission?
That's a question I love to answer because it is part of the Great Commission and completing the Great Commission in several different ways. We just start with the understanding that when you get right down to it, health is the most basic need that mankind experiences. If you have your health, you can pursue a job. If you have health, you can be a parent. If you have health, you can even pursue spiritual concerns. But if you don't have health, especially in the developing world, you're basically cast off. You're blamed and shamed for your illness. And again, working, parenting, even seeking your spiritual destiny is all put aside because you're rejected as an individual. So health is the most basic human need. And yet the World Health Organization from the UN tells us that we are about 7 million healthcare workers short of having a reasonable degree of coverage in the world. And that as the world population expands, that ratio is getting even smaller. So it's projected by 2030 that we'll be short about 12 million healthcare workers. To visualize it a little more, if you take the United States with our coverage of doctors to our population, Kenya in East Africa has about 10% of the same coverage that the US would have, about 10%. And then if you go to Malawi, a small country in Southeast Africa, they're about 10% of what Kenya is. So there is just a drastic lack of physicians and other healthcare professionals. So for that alone, that need brings a lot of people to medical missions who have a physical need and who are in a place where they're open to hearing the good news of the gospel from the folks that are providing the healthcare. So that scarcity of health resources is something that brings people to a very responsive place to the message of the gospel. Another aspect is that countries that won't accept missionaries will accept healthcare professionals. They may be staunchly Muslim and against any sort of Christian influence, but they have health needs. In fact, there's one nation, a Muslim nation, where they set aside 20 visas just for healthcare missionaries who staff a Christian hospital in their country. They need that hospital. So they won't let anybody in with a missionary visa, but they literally have about 20 visas set aside so that this hospital can be staffed by US personnel. So countries will accept healthcare folks that won't accept missionaries. And then healthcare workers fit in a variety of strategies. Some mission agencies specialize in church planting teams, and a physician on that team provides a vital bridge to the community that the church planting team is trying to reach. Other healthcare folks work in very isolated areas. There's a hospital in Niger, West Africa, which is 300 miles literally from any other healthcare facility. So people literally travel for days, really for days to get there. And again, they're mostly Muslims, but we can talk about this. Niger offers missionary visas and so forth. But these folks, most of the Muslims, are exposed to good medical care as well as the gospel. And then finally, there are developed churches such as the Africa Inland Church, AIM, the national church of that agency. They have their own healthcare facilities, such as the Kajabi Hospital near Nairobi, and healthcare workers from the U.S. staff help to staff that, but they are run by Africans, and yet we can fit into the strategy of the national church for providing healthcare and evangelism and other spiritual ministries.
Wow. Well, it's a great scan of both the opportunity and the need. That's what I was going to ask you next, but you've really answered a lot of this. It's what kind of need is out there. It sounds like the need is about as broad as we could imagine, both geographically and in the type of medical needs there are. Are there particulars?
If I could point out a kind of a curious contrast, I've obviously talked about doctors and nurses, but MedSend will provide grants for any board certified healthcare professional. That includes veterinarians. Obviously, veterinarians are taking care of animals, not people, but there are tribes in West Africa that are extremely appreciative of veterinarians who will come and help them to preserve their herds of cattle and sheep, goats, and so forth. So we even see veterinarians being welcomed, again, by groups that are largely Muslim, largely just close to the gospel, but they want help with their animals.
Mm-hmm. So I'm understanding that's a remarkable thing that I wouldn't have thought of, the veterinarian. Are there particular, I say, emphases of needs? Are you watching for general physicians or specialists, or is it simply all of the above?
It truly is all of the above.
Okay.
If you consider, for instance, eye care, optometrists, ophthalmologists, there are over 1 billion people who need corrective lenses and don't have them. And for us in the Western world, we need glasses. We go someplace and we get them, and we're good. But there are Nigerian truck drivers who need corrective lenses, and they still go about their work somehow, but without the proper vision to do their job. It just sounds crazy. In Sierra Leone, that's a small country on the west coast and the Gold Coast of Africa, they have four surgeons in a country that has about 4 million people. So how do you provide the surgical care that's needed? Well, you don't. And a lot of people suffer and die as a result.
Well, it's a very broad, sweeping opportunity, let's say, for our sisters and brothers who serve in healthcare. I wonder, Doug, if you could encourage us a bit with sharing where you've seen it happening, a story or two about where you've been blessed to see healthcare professionals really bringing and making a gospel impact.
Yeah, we had a mental health worker who worked in a closed Muslim country. I really can't name it, but she, as a mental health person, she was working with a psychiatrist who oversaw a major portion of their healthcare work in that country. Their approach in that country was to lock up those that were mentally ill. They put them in deserted prisons, literally in chains, and then this psychiatrist would meet with them and identify medications that they needed. But he had no concept of counseling, of talking with them, of trying to discover their needs. So this MedSend grant recipient with a mental health background was able to help this individual psychiatrist who was a Muslim to see the value of finding out what the needs of the individuals were by speaking with them, by counseling and giving direction, not just by medication and literally locking them up. And then while she was adding this vital dimension to the mental health system of this country, she was living in a neighborhood where she built relationships with folks, again, from a very closed Muslim group. And she saw a number of people come to Christ through her missional lifestyle in the area where she lived. So she was providing a vital improvement for the mental health of the country while being an effective evangelist with individuals. Another country has a hospital. Again, I can't really mention the name, but it's a strong Muslim country. But they asked for help from Protestant missionaries many years ago because their infant mortality rate was so high. Children were dying at such an alarming rate. So this missionary couple initially came and started this hospital. They drastically improved the problem of infant mortality. And the country is so indebted, the government built a new hospital and said you can share about the gospel within the four walls. We don't want you to come outside the four walls with your message, but you can share it with patients. So again, how could you imagine a Muslim country building the facility and building a very nice facility and then releasing them to share their message within the context of the healthcare?
Tremendous. Wow.
It's amazing to me. I mean, I've told these stories a bunch of times and it still gets me so excited just to share them again.
Incredible. Well, we see how the Lord is really using both the professional and the personal here, right? And the stories you've mentioned, there's that environment where their expertise and training is highly regarded and highly valued, but then all of the personal value of relationships and loving care and kindness is expressed there. It's a beautiful, beautiful combination. So thank you to those of you in our medical community. We know that in these COVID days, many of you have faced tremendous stressors, even working in our homelands. And here we are talking about extending that further, but we just want to say thank you for your service to us. Now, in just a couple of minutes, Doug is going to describe for us what MedSend calls a well-rounded approach to medical missions. And we're also going to talk about some of the obstacles faced and some next steps that people, medical professionals, and church leaders can take if there's an interest in pursuing medical missions. Before we get to that part of our conversation, we'd like to share with you this missions resource that we hope will be helpful to you and your church.
Your profession, your skills, your passions. It's you making disciples of the nations. Crossworld desires to help you engage the world's least reached marketplaces in the ways God has gifted you. Hear more about Crossworld right here on the podcast by listening to episode 109 called Making Disciples Through Our Vocations. To learn more about Crossworld and their global opportunities, visit crossworld.org. And now, back to today's conversation.
We are back with Pastor Doug Christgau, a global healthcare missions ambassador with MedSend. Doug, we've talked about some of the need and opportunities that exist in medical missions. How does MedSend describe a well-rounded approach to medical missions?
That's a great question because we are quite intentional in our application in seeing if the prospective grant recipient has certain aspects of care and healthcare in their plan for ministry. The first concern that we have is that we're aiming for sustainable health. It's wonderful to provide a cure for a disease or an illness, but there needs to be a plan for that person continuing to remain healthy. And that often means that there's a community health dimension in the work that we do. In other words, it's not just curing people, it's influencing the community to know how to avoid some practices that may have led to the health problem in the first place. It, could be needing to improve the quality of their water or, just the
dietary things like that, you mean?
Diet. And we actually have workers who train community health representatives for specific villages so that this kind of information can be disseminated through a national, not just through a Westerner. But sustainable health is certainly a part of it. So the second aspect of a well-rounded program would be to have the training of national workers. There are always national employees at clinics and hospitals. And even though they may not have gone to a med school or a nursing school, our grant recipients are typically aiming to provide them with training, improving their capacity to function as healthcare workers. So after sustainable health, we're looking to train national workers who can continue to provide care and to expand the number of people that have the capacity to give that care. And then the third aspect would be to integrate national spiritual resources. In other words, the hospital physician or surgeon, he can certainly pray with a patient. He might share the gospel. Many of our grant recipients do share the gospel. But if we're truly going to make disciples and integrate these folks out of the hospital and then into the Christian community, we need national chaplains, national pastors. So we work closely with them in many situations to assure the spiritual component of the care continues to be developed and to be sustained, not just the physical. So those are our three primary indicators that we're going about healthcare in a way that's most sustainable for the health physically and spiritually of the individual.
Right. Well, it sounds like a very wise combination, aiming for sustainable health, training national workers, and integrating with national or local spiritual resources. Doug, there are going to be barriers, there are going to be obstacles for medical professionals who might like to participate in this way. One of the ones you've mentioned is educational debt, which of course can be considerable. What are some of the other obstacles that you have seen and try and help address through MedSend?
Well, these actually fall more to our partner agencies. I might not have made it clear enough before, but we provide grants to healthcare workers, but all of these healthcare workers are affiliated with recognized mission agencies. We call them our associates. And I believe Send is one of our partners, along with, as I said, 50 others or so. So we encounter these obstacles with the sending agency and depend on them as well as any counsel we can give. But, believe it or not, after educational debt as obstacles to going to the field, the resistance of parents who are proud to see their son or daughter become a physician and anticipate the status and the comfort and the fulfillment of a healthcare career in the US. And then they find out their doctor daughter is going to go to a hospital in a remote area of Niger, West Africa, and there is resistance. There's just no question about it, even amongst Christian parents. So that's a concern. And then the other is a church that has a would-be missionary in their congregation, but they really don't know what to do with that. They've never had someone with missions interest before. They have a vague idea that, it must be a good thing for a missionary to go from our church, but how to actually support that missionary and to stand with them in this process is another challenge. And that's where we as an organization do work with churches. We want to know who the sending church is. We have a reference form from a staff member of the church. So we try to make sure that the church is equipped to be the supportive body that they need to be for this mission.
Mm-hmm. Well, helping with the sending churches, making sure that they're well equipped. Educational debt, you mentioned, probably is the bright one or the initial one that the organization began to address. I just wonder if you'd go back to the resistance of loved ones and family members or parents. Is there anything that you think that we can really do, either as MedSend or as associate agencies, to really be alongside in that challenge?
We have what's called a grant administrator on our staff, and her responsibility is to walk with the grant applicants through whatever challenges they might face. So we try to provide personal encouragement and counsel. But I think, again, this is something where the sending church can play a role as well. I know, again, as a former missions pastor, I talk with more than one parent about the need for them to trust the Lord with the direction that their son or daughter was going in as it relates to missions. And I think, again, it's probably the local church that's going to have the greatest impact because they have the relationship with the parents.
It's very good. Well, I'm supposing that some of our listeners might be interested, and they may be goers, Doug, or they may be senders, they may be church leaders. I'd like to just spend the last couple of minutes talking about next steps. What next steps would you encourage these interested people to take?
Well, I think involvement with the Christian Medical and Dental Association is important. CMDA represents Christian healthcare both in the United States and around the world. They have a very strong missions component, and they have chapters of CMDA students on various medical college campuses. This is secular campuses. They'll have Christian groups, similar to what you might think of like an intervarsity group on a secular campus. So if folks are actually in training at this point, connecting with CMDA is an excellent step. They have conferences as well as groups on campuses. And then there's another event called the Global Missions Health Conference, GMHC. That's in Louisville, Kentucky, every November. And that's a 3-day event that is just outstanding, both in the instruction that it provides, in the inspiration. And we have close to 50 exhibitors, all of them with healthcare missions interests of one kind or another. So I just highly recommend that as a resource.
Well, some great ideas there. And we will include these in the show notes, as well as the links to this event and perhaps some other things that have been mentioned along the way during this episode here. So you can check out those show notes at globalmissionspodcast.com. Doug, if any of our listeners might like to further the conversation and reach out to you, how could they best do that?
I'd love to hear from anyone in the podcast. And my email is doug@medsend.org. And that can be in the show notes. And I'd be glad to interact. I'll come without any charge to any group, like a CMDA group or a Christian college campus. And I'd love to talk about healthcare missions. And that's what I spend a fair amount of my time doing.
Sure. Well, as you listen today, you can see how Doug has been really, I think, uniquely prepared by the Lord to have decades of experience in global missions. And now to be connected to this particular element, it's a very rich combination and very beautiful to see some of the fruit coming out of that, Doug. last question that you've had before because you've been on the podcast before, but let's bring it to this topic about medical missions. If you had the opportunity to stand in front of the missions committee of a local church, perhaps together with the pastor, it's a group of people who really do want to do missions well from their local congregation, and you could address them, what would you like to say to them today?
Having been a pastor myself, and I'm active in my local church as a volunteer still, I would say don't let the decline of the church in the US and Canada discourage or mislead you, because around the world, the gospel is being proclaimed and the Great Commission is having impact. We just tend not to see it so clearly here in North America. So I would say if you want to see your prayers answered and you want to see impact from your financial giving, then be committed to making disciples among the unreached around the world. And there are many specialties through which this can be done, even in closed countries. Healthcare missions is certainly one of them. So is business as mission. So is teaching English as a second language. Those are the three major strategies for penetrating the unreached world. But I just want to encourage you to move ahead and believe that God is still at work, and that he's at work with the greatest measurable results at this time in the developing world of Africa and Southeast Asia.
Well, Doug, again, thank you so much for being part of the podcast family, in a sense. You've been here 4 times now. Thanks so much for joining us today to talk about medical missions. May the Lord bless you.
Thank you. It's my pleasure to be here, and I hope to hear from some of the listeners.
What a great conversation with Doug today. Thank you for listening in. I know not all of our listeners will be in the medical field necessarily, but we think this topic has implications in other ways as well. And I'm sure you picked out some of those as you were listening. But Megs, I'd like to just hear from you. What stood out to you from this topic today?
Sure. Well, as usual, it was not easy to pick a single highlight, Maddie. Just so many good ideas. But the one that I was encouraged by, again, is an organization that really wants to help remove the barriers to people participating in missions. And this, in this case, was a financial barrier. But this was one of the original purposes of MedSend, was to try and get that barrier of educational debt out of the way so that medical professionals could get to the field sooner and exercise those gifts. I love that. I love how it's expanded so it includes the possibility of scholarships for students in other countries to study in their local context as well, which just seems so very healthy and wise. And all of this connects us to senders. So like you just said a minute ago, many of our listeners will not be medical professionals themselves, but you can help release the potential of a medical student who is facing the repayment of debt, or a student in another country, by giving generously to God's work. And so we don't want to make it all about money, but I just love that senders can really help advance this part of God's work.
Mm-hmm. And if I can just briefly speak a bit more generally to this topic, I was so inspired and encouraged because to me, this topic is so beautiful, and the opportunity that medical missionaries have in particular is amazing to me. I think of Jesus's ministry as we read all throughout the Gospels of providing physical healing and then offering spiritual life through himself. And so this episode to me just brings that back to the forefront of my mind as we care for the physical well-being of people, just the joy that it is also to share the abundant life that comes through Christ. So I come away from this episode feeling very encouraged, and I hope our listeners feel the same way.
Yes, completely agree. Glad to be co-hosting together with you, Maddie. We'll remind our listeners that this episode is brought to you, the listener, by the Global Missions Toolbox, an online collection of resources, especially for senders, pastors, missions committees, and family and friends of workers who have been sent to serve in missions. We invite you to join us again in 2 weeks when we'll continue to explore this grand adventure of being Christ's witnesses to the ends of the earth.